Okay, let's continue with case number 9. A 24-year-old American man is traveling in rural India during the monsoon season. Over the course of a few hours, he develops severe watery diarrhea. In the next 30 hours, he has approximately 1 episode per hour of liquid stools that appear clear with small white flecks of mucus. He also has occasional episodes of vomiting. He quickly becomes lethargic and generally ill with crampy abdominal pain, but is afebrile. He attempts to rehydrate himself during the illness, and the symptoms resolve within approximately 48 hours. What is the most likely diagnosis? This patient has cholera, a potentially fatal dehydrating illness caused by Vibrio cholerae. This microorganism is a gram-negative, curved, motile, polar, flagellated rod that resembles shooting stars on gram stain. Symptomatic cholera usually manifests in epidemics, and it is endemic to developing regions of Africa, Asia, South and Latin America, and recently the Middle East. What is the primary differential diagnosis? Watery diarrhea induced during travel within a foreign country makes the non-invasive enterotoxigenic Escherichia coli, or ETEC, infection the primary differential diagnosis, or traveler's diarrhea. However, ETEC diarrhea is not associated with white mucus flecks and is generally not as voluminous as the diarrhea induced by cholera. How does the microorganism involved in this condition exert its effect on the GI tract? Cholerae is ingested through fecally contaminated water. It secretes an exotoxin, which is called cholera toxin, that binds to the surface of the intestinal epithelium. So remember that when we're talking about an exotoxin, it could be either gram-positive or gram-negative. But if it's an endotoxin, it's just gram-negative. And remember, it's called cholera toxin. This toxin, ADP ribosylates adenyl cyclase, thus increasing levels of cyclic adenosine monophosphate, or CAMP, within the intestinal mucosa. This causes increased chloride secretion and decreased sodium absorption, leading to a massive secretory loss of fluids and electrolytes. Remember, it increases chloride secretion and decreases sodium absorption. What are the clinical manifestations of this condition? The hallmark of cholera is rice water stools, so described because the small white flecks of mucus resemble grains of rice. The onset of this diarrhea typically occurs 1 to 3 days after infection. Vomiting and abdominal cramping is common, but fever is rare because V. cholerae itself is non-invasive and thus remains in the GI tract. Many infections are asymptomatic, but severe cholera can lead to extreme dehydration that can cause death within hours due to the excretion of electrolytes, leading to renal failure, arrhythmias and hypokalemia, and metabolic acidosis from bicarbonate loss. What is the appropriate treatment for this condition? Oral rehydration solution, ORS, which has reduced mortality rates from 50% to less than 1%. A typical preparation of ORS contains glucose, potassium chloride, sodium chloride, and sodium bicarbonate. One more time. Glucose, potassium chloride, sodium chloride, and sodium bicarbonate. Glucose facilitates sodium absorption from the gut, which allows for the concurrent absorption of water. Antibiotics are of limited use in stopping the diarrhea, although early use of doxycycline can reduce the volume of diarrhea and decrease the duration of bacteria excretion by 1 day.